Welcome back, guys. It's Dr. Somji.
And Dr. Solomon.
This is a follow-up video on Gua Sha in terms of how to do it for specific areas in the face. So let's get into it. So first things first, I like to use rosehip oil, organic cold pressed rosehip oil from The Ordinary. I do like it. I also sometimes use the marula oil. And if I'm doing it way into the scalp, argan oil is also a good idea as well. But for the purpose of the video today, I'm going to use rosehip oil because it's nice and calming, reduces inflammation. It doesn't clog my pores up. It can for some individuals, so you've got to be a bit careful. So generally, you're going to put like 4 or 5 drops on the fingers, and then you're going to dab equally around all areas of the face, going from inside to out. That gives you that nice coverage, and also way into your beard and into your neckline as well. So cover each area thinly. You don't need to go too crazy with it. I see people like literally pouring oil on there, and I think that's a little bit too crazy.
Yeah, and just whilst you're doing that, worth talking about the oils again. So we talked in our previous video about the almond oils, vitamin E oil, jojoba oils, using rosehip oil, argan oils. All of them do have a common sort of anti-aging component to them.
Those 3 that we talked about, you know, the rosehip, the argan, and the marula, you want to stick to. Yeah. Because vitamin E can make things a bit more sensitive as well.
And in terms of the science behind it, whilst you're getting your Gua Sha device ready, really the science is limited. However, there are studies, maybe low-powered studies, to suggest that it might reduce stress, inflammation, and pain. We do know it also helps with lymphatic drainage. We know that simply from the anatomy of the area. So is there any harm? That's what we often look.
I think if you're going to overdo it, if you're going to do it the Sha way, which is causing red marks, then that can be a little bit harmful. So you've got to be a bit careful. But that's it. You know, you can put serums in with this. That's the other thing. But you should really use your hands. I guess this is just for like lymphatic drainage. Okay. And if you've got puffiness underneath the eyes, which is the first one we're going to start with, right?
And let's start there, and then we can talk through it.
So just to say, I've cleansed this with nice soap and water, so it's completely sterile. Cleanse my hands before I put my oil on. These are all basics that you need to be doing.
Okay. So you've lubricated the area. Yeah. And you're ready to start.
Yeah. So Dr. Son's going to talk us through exactly what I'm doing as we go.
Yeah, so I mean the area is lubricated with the oil. The Gua Sha tool has been cleansed. You see Dr. Somji is moving medially to laterally, so from the inner part of the eye area and cheek area all the way to the outer area. And he will then rotate the device and move slightly down and out. The reason he's doing that is because he's following the channels of lymphatic drainage. So if you see from the diagram that we'll put up, the lymphatic channels do flow both down and out, and then ultimately into the neck, and then the lymphatics flow into the venous system of the body. And so that's for another topic, another day.
Yeah, and I mean a few practical tips. I'm not doing this and then going back, because that does the wrong thing. You've got to come here, lift up, and then go back. And also this little area, you don't want that above the bone, because that can really damage things, and that's when you can actually get things. So stick to underneath that bone area. That's really crucial.
And the reason you're doing that is because the skin is thicker there. The skin is very thin in the under eye areas. We know when we fill that area.
Yeah, beyond the orbital bone.
Yeah, I mean the skin can be anywhere from 0.2 to 0.3 millimeters at times.
And then what about the upper brow?
So upper brow as well. There are lymphatic channels draining to there. You're also promoting blood flow to the area. But again, you're following that same path out.
I'm being super gentle here, guys. More gentle than I was there, because it can be quite painful. But if you get that sort of puffiness above your eyes, it is really useful too. Yeah. Right, so next area, are we going to talk about the neck?
Nose.
Okay, nose. Let's talk about the nose.
So let's talk about the nose now.
So what do I do with the nose?
So with the nose, you're going to lightly scrape it, and you're going to move down the sides of the nose 3 times on each side and work your way into the cheeks. And again, you're following the venous and lymphatic channels to drain that area, and then back into the lymphatic channels that work their way around the eyes and the cheeks. So think of it tributaries of a river, and you're flowing into the main rivers which flow into the ocean. And that's essentially what you're trying to do.
And if someone's had a rhinoplasty, how long after can you do this?
Generally, with any surgical procedure, I would wait a minimum of 2 to 3 months afterwards.
But they can do that for like a little longer term swelling, I guess.
Yes,
right?
it can help
Yeah.
in the healing process, but you have to be very, very gentle. I'd say minimal of 6 weeks afterwards.
Yeah.
And for longer term swelling, certainly from 6 weeks onwards, I usually push it to about 2 to 3 months.
Yeah.
It can certainly help with that. So as you know, with most surgical cases, you can get swelling and puffiness for months afterwards.
Cool. Next area?
Okay. Next area, the décolletage. Oh no, the chin.
Chin, okay.
Okay, so next area, the chin.
Yeah.
Again, about 3 to 4 times, guiding the tool from the middle of your chin along the jawline towards the ear. Again, you can see similar pattern, out and down, and you're following that pathway to the main tributary, using my analogy of the river, and that's going back into the neck, and then the neck is draining into the venous system. So the big vein channels that will ultimately drain into the heart, and then that will be, essentially filtered.
Yeah, I mean, this is kind of good for my neck as well, because I get a lot of tension in there.
Which is our next area.
Ah, okay. there we go.
So starting on the outer corner of the jawline, you will then work your way down the neck just to the area above your collarbone. So you have to go out and laterally
So how do
that
I do
way.
this?
So go down and then outwards towards your collarbone. And you repeat about 3 to 4 times on each side. We know from our anatomy that the big veins there, deep inside there, where the lymphatics drain into, are feeding directly back into the heart, and that's ultimately, in fact, that is what we're aiming for. We're aiming for all that fluid to be drained and filtered.
So it's
through
important
the heart.
also to drain back here as well, right? Because you've got a separate set.
Yeah, it's an area we call the posterior triangle of the neck, and also further up where we were draining.
Feels good, guys. Really does.
It's the posterior triangle of the neck and the preauricular area of the ear, so behind the ear and the
Post-auricular, yeah.
and the posterior triangle of the neck, which is where the big veins are again. So lymphatics into veins, veins into bigger veins, and then ultimately into the heart. No,
and a lot of people do this, like they kind of start contouring. What do you feel about that? Then, does that really do much for the contour?
No, it doesn't. It's
Yeah,
ultimately you're simply just draining fluid. You're not going to contour the face with this, but what you're trying to do is reduce the swelling, initial swelling. Reduce the residual swelling you might have, which can be sort of due to fluid intake. It could be due to lack of sleep, dietary factors.
It's important to use different edges to see what has most contact. I guess you got to have most contact. I do like using the sharp edge because I feel like I can do more with it. But then at the end, you can do like a nice little flow to all those lymphatic nodes.
Yeah, and an unsung hero about all of this, and in fact, generally with massage, is the release of endorphins and release of dopamine.
I mean, I'm kind of feeling really relaxed.
Yeah, and there's some positive mental health benefits of that. So releasing natural endorphins, releasing your natural dopamines, that will just make you feel good. And when you feel good, you're generally better in health.
What about the forehead? Because everyone else tells me about forehead.
So with the forehead, the general sort of rule is you start in the middle of your forehead, work your way down to the temples, and then all the way back down to the hairline.
So coming down
again,
like this.
And again down towards the jawline, and then outwards again. So you're
So like this, you're going to want to try and drain to this preauricular area.
I'd say be a bit more gentle on the forehead, simply because the
it's
skin is
kind of
slightly
is a
thinner
bit,
there, and it's more bony there. So
obviously, I'm using the bigger side of the Gua Sha, but mainly because I've got a really big forehead.
yeah, and that's quite important because you have multiple sides and multiple.
I mean, it's quite
angles to that.
ergonomic, definitely. Okay, perfect.
And that's a full face.
So how
Gua
many
Sha.
sort of passes should you be doing each one?
Generally, if you're firm enough, 3 to 4 passes on each area.
Okay, and then how often should you be doing this?
2 to 3 times a week is the general rule. Again, there's no hard and fast rule here. It's just that this is just based on anecdotal evidence. It'd be interesting if somebody actually did a study on this one day and possibly even used MRI scans to check whether
I think
there
the
was.
only person that would do that is the guy that's offshore right now, Solomon. So obviously we know how many times you're going to do it. You want to do it 2-3 times a week. Any important do's and don'ts that people need to know?
I'd say again the importance of selecting the right oils, cleansing the device, and don't hurt yourself.
Yeah, okay, cool. And then I think that also not using too many active ingredients afterwards. So no kind of like stronger retinols, no AHAs, BHAs, acids, etc. afterwards. Just be kind to the skin because you've created micro trauma pretty much everywhere, and you just want to do things that are just going to help restore the skin. That's perfect. If you have any other questions about Gua Sha, we've been pretty complete. But just let us know in the comments below and we'll get back to you. That's one of our really important things, interacting with you guys. Don't forget to click the link to subscribe, as well as that bell button, because that will tell you when new videos are going to be uploaded. We've got loads of videos coming for you guys. Thank you so much.